Hey everyone, welcome to today's video. In this episode, we're going to dive into a topic that's both fascinating and important: amphetamine. Whether you've heard about it in the context of prescription medications like Adderall, or seen it in the media as a street drug, amphetamines have a major impact on the brain and body. But what exactly are they? How do they work, and why do they have such powerful effects, both positive and negative? We're going to explore all of that in detail, breaking it down in simple terms. You'll learn how amphetamines affect our physical and mental health, the benefits they provide in medical treatments, and, most importantly, the serious risks of misuse and long-term abuse. Whether you're here to better understand the science, get informed about potential dangers, or simply satisfy your curiosity, this video has got you covered. So let's jump in and get started. Amphetamine is a potent central nervous system, CNS stimulant. It has been in use since the early 20th century and is primarily used for medical conditions such as attention deficit hyperactivity disorder, ADHD, and narcolepsy. Chemically, amphetamine belongs to a class of drugs known as sympathomimetic amines, which mimic the effects of the sympathetic nervous system. The substance is synthetic, and its active compounds work by increasing levels of certain neurotransmitters in the brain, particularly dopamine, norepinephrine, and serotonin. Amphetamines are derived from phenethylamine, a compound found in trace amounts in certain plants and animals. The medical forms of amphetamine, such as amphetamine sulfate, are prescribed under various brand names, including Adderall, which is commonly used for treating ADHD. When used under medical supervision, amphetamines can improve focus and wakefulness, providing significant benefits for those with attention deficits or sleep disorders. Despite its legitimate medical uses, amphetamines are often misused recreationally due to their stimulant properties. The illicit use of amphetamines is linked to increased energy, enhanced focus, and euphoric feelings. While amphetamines do offer short-term benefits for specific conditions, their widespread recreational use raises significant concerns due to the risks of addiction and harmful side effects. As a result, amphetamines are tightly regulated in many countries due to their potential for abuse and addiction. The way amphetamines affect the brain is crucial to understanding both their therapeutic benefits and their risks. The drug increases the activity of neurotransmitters, particularly dopamine, which is associated with the brain's reward system. However, this can lead to a range of negative consequences when used inappropriately, as we will explore in further sections. When amphetamines are ingested, they quickly enter the bloodstream and reach the brain, where they exert their primary effects on neurotransmitter systems. One of the key targets is dopamine, a neurotransmitter involved in motivation, reward, and pleasure. Amphetamine stimulates the release of dopamine from nerve terminals and inhibits its reuptake, which increases dopamine levels in the brain. This surge in dopamine activity produces feelings of euphoria, increased energy, and enhanced focus, which explains the popularity of amphetamines for recreational use. Along with dopamine, amphetamines also elevate the levels of norepinephrine, a neurotransmitter associated with the body's fight or flight response. Increased norepinephrine leads to physiological changes such as elevated heart rate, increased blood pressure, and vasoconstriction, narrowing of blood vessels. These changes prepare the body for heightened physical activity, which explains the burst of energy that users often experience. Additionally, amphetamines impact serotonin, a neurotransmitter involved in mood regulation. The release of serotonin can contribute to a sense of well-being and emotional stability. However, this effect is typically short-lived, and as the drug's effects wear off, users may experience mood swings, fatigue, and irritability, leading to what is often called a crash. This crash can encourage individuals to take more of the drug to avoid these negative feelings. Another way amphetamines affect the body is by increasing the release of glutamate, an excitatory neurotransmitter that enhances brain activity. This can lead to heightened alertness, improved concentration, and, in some cases, hyperactivity. These effects are why amphetamines are commonly used to treat ADHD, as they help individuals concentrate better and control impulsive behavior. While amphetamines can offer therapeutic benefits in certain medical conditions, their use, especially in non-prescribed recreational settings, can lead to a range of negative short-term effects. One of the most immediate consequences of taking amphetamines is an increase in heart rate and blood pressure. This can be particularly dangerous for individuals with pre-existing cardiovascular conditions, as the stimulant effects of amphetamines put additional strain on the heart and blood vessels. Elevated blood pressure may also increase the risk of stroke, heart attack, or arrhythmias, irregular heartbeats. Another common short-term effect of amphetamines is reduced appetite. Many individuals who use amphetamines experience a loss of hunger, which can lead to unhealthy weight loss if used regularly. This effect is linked to the impact of amphetamines on norepinephrine, which regulates hunger signals in the brain. This reduction in appetite is often one of the reasons amphetamines are abused, particularly in the context of weight loss or body image concerns. Amphetamines also affect sleep patterns, making it difficult for users to fall asleep or maintain restful sleep. This is due to the stimulating properties of the drug, which increase alertness and energy. Prolonged wakefulness can lead to sleep deprivation, resulting in fatigue, cognitive impairments, and mood disturbances once the drug's effects wear off. These sleep disturbances are a key component of the crash that often follows amphetamine use. Users may also experience psychological effects such as anxiety, agitation, and irritability, particularly when the drug's effects begin to wear off. In some cases, users may feel paranoid, aggressive, or hostile, which can lead to risky behaviors or conflicts with others. These psychological effects are often temporary but can be distressing and, in some cases, dangerous. The long-term use of amphetamines presents more serious risks, both to physical and mental health. Prolonged exposure to high levels of dopamine can cause long-lasting changes in the brain, leading to cognitive deficits. These deficits may include difficulties with memory, attention, and learning, which can have a significant impact on an individual's daily functioning and quality of life. Chronic amphetamine use may also lead to decreased motivation, as the brain's reward system becomes less responsive to natural stimuli. Perhaps one of the most concerning long-term effects of amphetamine use is the risk of developing mental health disorders. Chronic use of amphetamines has been linked to anxiety disorders, depression, and even psychosis. Users who consume amphetamines for extended periods may develop symptoms similar to those of schizophrenia, including delusions, hallucinations, and disorganized thinking. This condition, known as amphetamine-induced psychosis, can be triggered by high doses or long-term use of the drug. In addition to mental health issues, the long-term abuse of amphetamines can cause severe damage to the cardiovascular system. The sustained elevation in heart rate and blood pressure associated with chronic amphetamine use can lead to a range of cardiovascular problems, including heart disease, heart attacks, strokes, and even sudden death. Users may also experience damage to blood vessels, which can result in poor circulation and damage to other organs over time. Chronic amphetamine use can also lead to significant dental problems, commonly referred to as meth mouth, particularly in those who use methamphetamine, a potent form of amphetamine. This condition involves severe tooth decay, gum disease, and tooth loss due to a combination of dry mouth, poor hygiene, and the direct effects of the drug on oral health. One of the most dangerous consequences of repeated amphetamine use is the development of addiction. Amphetamines are highly addictive substances due to their ability to stimulate the release of dopamine, a neurotransmitter that plays a key role in the brain's reward and pleasure system. Over time, the brain becomes reliant on the drug to experience pleasure, which can lead to the development of tolerance. This means that individuals need to take higher doses of the drug to achieve the same effects, increasing the potential for overdose and harm. As tolerance builds, users may begin to take amphetamines more frequently, resulting in physical and psychological dependence. Dependence is characterized by the need to continue using the drug to avoid withdrawal symptoms. These symptoms can include fatigue, depression, anxiety, irritability, and intense cravings for the drug. Withdrawal from amphetamines can be particularly challenging and may require medical supervision to ensure safety and support during the recovery process. The cycle of use, tolerance, and withdrawal often leads to compulsive drug-seeking behavior, making it difficult for users to stop without professional help. Individuals who are addicted to amphetamines may engage in risky behaviors such as stealing, lying, or compromising their health in an attempt to obtain more of the drug. The social and professional consequences of addiction can be severe, leading to strained relationships, job loss, and legal problems. One of the more severe mental health consequences of long-term or high-dose amphetamine use is amphetamine-induced psychosis. This condition shares many similarities with schizophrenia and can involve symptoms such as delusions, false beliefs, hallucinations, seeing or hearing things that aren't there, and disorganized thinking. Amphetamine-induced psychosis typically occurs after prolonged or heavy use of the drug and can lead to dangerous behavior due to impaired judgment and distorted perceptions of reality. The exact mechanisms by which amphetamines induce psychosis are not fully understood, but they are thought to be related to the drug's effects on dopamine and serotonin systems in the brain. Excessive dopamine activity, particularly in areas of the brain involved in reward and emotional regulation, can lead to the onset of psychotic symptoms. These symptoms can range from mild paranoia and agitation to more severe forms of delusional thinking and hallucinations. In many cases, amphetamine-induced psychosis resolves after the drug is discontinued and the individual undergoes detoxification. However, in some instances, the psychotic symptoms may persist for weeks or even months after the individual has stopped using the drug. In rare cases, long-term use of amphetamines can lead to lasting changes in brain chemistry, resulting in permanent cognitive deficits and an increased risk of developing chronic psychotic disorders. An amphetamine overdose is a serious and potentially life-threatening medical emergency. When taken in excessive amounts, amphetamines can cause a range of severe health issues, many of which are related to the drug's stimulant effects on the cardiovascular system. The most immediate danger is the risk of heart attack, stroke, or severe arrhythmias, irregular heartbeats, all of which can be fatal if not addressed quickly. In addition to cardiovascular risks, an overdose can also lead to hyperthermia, elevated body temperature, seizures, respiratory distress, and loss of consciousness. Symptoms of an overdose may include agitation, confusion, extreme anxiety, rapid heartbeat, and profuse sweating. In some cases, overdose can lead to organ failure, coma, and death if the individual does not receive prompt medical treatment. Emergency medical treatment for amphetamine overdose typically includes supportive care, such as intravenous fluids, medications to control seizures and blood pressure, and cooling measures to manage hyperthermia. In some cases, the use of sedatives or antipsychotic medications may be required to manage agitation and psychotic symptoms. With proper treatment, individuals may recover from an overdose, but the long-term effects of an overdose can include brain damage and organ dysfunction. In addition to the health risks associated with amphetamine use, there are significant legal and social consequences to consider. Many forms of amphetamine, such as methamphetamine, are classified as controlled substances due to their high potential for abuse and addiction. This means that possessing, distributing, or using these drugs without a prescription is illegal in many countries. People caught using or trafficking amphetamines can face criminal charges, including fines, imprisonment, and a permanent criminal record. The social consequences of amphetamine abuse can be equally damaging. Chronic use of the drug can lead to the deterioration of personal relationships as individuals become increasingly consumed by their need to obtain and use the drug. This can result in strained family relationships, social isolation, and a decline in overall social functioning. In the workplace, individuals who abuse amphetamines may experience job loss, legal issues, and a decrease in professional performance. Furthermore, long-term abuse often results in financial difficulties as individuals may prioritize drug use over basic living expenses. These social consequences can have a lasting impact on an individual's life, making recovery more challenging. Given the many risks associated with amphetamine use, individuals struggling with addiction or misuse of the drug should seek professional help. Treatment for amphetamine addiction typically involves a combination of behavioral therapies, medical support, and peer group counseling. Cognitive behavioral therapy, CBT, is one of the most commonly used therapeutic approaches, helping individuals change their thought patterns and behaviors that contribute to drug use. Inpatient and outpatient rehabilitation programs provide structured environments for individuals to detox from amphetamines safely. These programs offer a combination of medical care, counseling, and social support to help individuals manage withdrawal symptoms and prevent relapse. Many treatment centers also offer aftercare services, such as continued therapy and support groups, to help individuals maintain long-term recovery. Support groups such as Narcotics Anonymous, NA, are also beneficial for individuals recovering from amphetamine addiction. These groups provide a sense of community and support, where individuals can share their experiences and receive guidance from others who have faced similar struggles. In conclusion, amphetamines are powerful stimulants with both therapeutic and harmful effects. While they can be beneficial when prescribed for conditions like ADHD and narcolepsy, their potential for abuse, addiction, and serious health consequences makes them a dangerous substance when misused. It is essential to understand the risks associated with amphetamine use, both short-term and long-term, in order to make informed decisions about its use. For those struggling with addiction, seeking professional help and support can help guide the path to recovery, minimizing the harm caused by amphetamines in the long run. All right, that wraps up today's deep dive into amphetamines. We've covered everything from how they work in the brain and body to the potential risks and dangers of misuse. Whether it's for treating medical conditions or being misused recreationally, amphetamines have a powerful impact, and it's important to approach them with awareness and caution. If you learned something new today or found the video helpful, don't forget to hit the like button and share it with anyone who might benefit from this information. And of course, if you've got any questions or thoughts, feel free to drop them in the comments. Let's keep the conversation going. Thanks for watching, and remember, understanding the science behind substances like amphetamines can help us make smarter, safer decisions. Stay informed, stay safe, and I'll see you in the next video.